Well, hello, everyone. This is Jeannie White, producer of The Wine and Cheese through Passionate World Talk Radio. Today we have another interesting guest. We've got quite a few guests on, and the one that I think you're really going to enjoy to hear about is, her name is Susan Andrea. And Sheila and Lorraine Brennen and Elizabeth Dalton will all be talking to her. But anyways, it's the Wine and Cheese Hour, so I'm going to turn it over to Sheila Wilson.
Thank you, Jeannie White. But thank you for having us on Wine and Cheese series. And thank you to Lillian Caldwell. Tonight we're going to talk about telemedicine, which includes telephone and video visits and how it really works. As Jeannie said, our speaker tonight is Susan Andrea. She is a nurse practitioner, and she works in a private physician office. She's been doing this telemedicine since the outbreak of the pandemic. The other guests I have, as Jeannie said, is Lorraine Brennen, a nurse, and Liz Dalton, also a nurse. So hello, Andrea, and welcome to the show. Can you tell us a little bit about this telemedicine? And does it really work?
Yes, it does. I work in a private practice, primary care office in Brockton, Massachusetts, with Dr. Douglas Grogan at Bethel Family Medicine. And we've been doing this since the beginning of the COVID epidemic. So it includes video visits. We use a program called Doxy.me and phone calls. And it's allowing us to continue to see our patients through video, actually seeing them on the screen. They talk to us, we talk to them, and we're able to diagnose and treat on these visits. And if they're not able to access these video visits, we will phone call them at a particular time that we've both agreed on, and we are able to do a visit on the phone call also. And we already have their chart available to us on the computer, the electronic medical record, so we already know about them. So we're able to answer and diagnose and go over med lists and past medical history, et cetera, during these calls. So this has really been wonderful for us. We love doing this. A lot of our patients, we do not want to leave the house, especially our seniors, and other people we have in our practice that can't leave the house and do not want to leave the house. So this has been wonderful, keeping people out of urgent care and emergency rooms, and it keeps our doors available and accessible to them, so they can outreach to us with anything. We're also available in the office, a very skeleton crew, to answer calls and refill medications, keep their medical areas open to them so that they don't feel like they're alone. And there are still people that won't come for quite some time, and that's okay. This has really opened the doors. Most offices are doing this right now, private doctors as well as hospitals, specialists, cardiologists, pulmonologists. This has been a wonderful opportunity for mental health providers to service the public also, because this is a very big area of need right now, depression, anxiety, so this has been wonderful for them too. This keeps patients safe at home. Most of our patients are using it and really like it a lot. We've gotten quite a lot of good reviews. And we use this also for follow-up visits. So if you happen to have had some labs done and we really don't need to see you back in the office, you can actually use this video chat visit to go over the labs, determine what to do about it, new medications, new treatment plans. Other visits that we use this for would be, of course, mental health, labs, and some minor illnesses. The patients are able to give us quite a description of their illness, and we can actually visually see them, a rash. These are really nice videos, so we can see quite a bit and actually assess and make a diagnosis and treat.
Susan, what if somebody doesn't have a computer or something? How do you deal with them?
So a phone call would be a wonderful option for them. They would call the office, and a time would be determined for me to call them at, 10 o'clock. I would call them at 10. And we would talk about what it is that's the issue, and we would determine how to treat that. And
what if it was a rash, like you just mentioned?
Well, we are able to cue them to ask them many questions about what the rash would look like, where it is, what does it look like, give us a really clear description. And we are able to come to a really good conclusion, and if we're stumped and we can't figure it out, we would probably have them either be seen if we felt it was an emergency, or maybe try a mild cream. It depends. It really depends on the person. We know our patients quite well, so we're able to know what their medications are. If they're a new medication, it could be a hive, or if they're outside poison ivy rash, things like that. So there's a lot of things that we can actually treat over the phone based on what they're telling us, and we use particular words to help with the diagnosis.
Well, how about if somebody called up and thought they had a urinary tract infection? I mean, you can't see their urine.
But we can ask them questions. So we would ask them, what are their symptoms? Do they have any pain? We have their record available to us, so we can determine if this is recurrent. We also know some of their medical history, like if they have stress incontinence, they're older, if they have other issues going on. We just look through their records. So we can talk about that. That's part of that subjective piece of information that they give us. And then we ask them about the pain, back, belly, anything else going on in their body that might be different. And we can pretty much make a good assessment. And since we really don't want them in the office, if we felt that they needed an antibiotic, we would give them one. And if they're not any better in 1 to 2 days, they would give us a call. If they're worse, they would give us a call so we can change the treatment.
Huh.
Hello?
Well, now, can I ask, Laura, did you want something?
No, I got disconnected.
Oh.
So I just came back on.
Okay. Susan, could you possibly tell me if, suppose somebody had an infection in their foot or something like that, a diabetic or something like that, is telemedicine a good way to do that so the person didn't have to go to the doctors?
Well, it depends. It really depends on the person and what kind. I think maybe because we're right now in a pandemic and we're not taking certain visits, maybe a video visit would be a good first visit so that we can assess what's going on in the foot, because we have good quality videos. And we can actually look at their foot. You can move the camera around. We could fever, chills, the pain, the progression, and then we could make a determination if they need to go to the emergency room, or if we could get them an immediate visit with the podiatrist, because these are urgent visits that are allowed. So it would be maybe a very good initial visit during this time. And maybe, if we can continue doing these visits after this pandemic has quieted down, we're able to move about more, we can continue that. I think it would be a nice initial visit for most patients, but we'd look in their chart and find out what their history is and if they've had this before and how uncontrolled their diabetes is.
So are you bringing anybody in at all? If you have to bring them in for a visit, are your doctors seeing anybody?
Yes, we are.
You are.
We've got some patients this week where we have a list of what we can and can't do from the HHS, from Governor Baker's office, and these are patients that we're not doing any preventative health right now, so we're seeing more of the urgent care, patients that have to come in. For example, uncontrolled diabetes, we're managing their insulin, we need to bring them in for some blood levels, blood pressure problems, signs and symptoms of some kind of acute illness, abdominal pain, those kinds of things we've been seeing in the office this week.
Wow.
But again, I was talking to Sheila earlier today. These are patients that make an appointment. They've already been screened for COVID on the phone. They wait in their car in the parking lot. They call when they get to the office. We bring them in, check their temp, give them another questionnaire as to COVID, and they're brisked right into the room where we've already have PPE on, Their vital signs are checked, etc. So there's never any crossing of patients. There's always only one patient coming into the hallway at the time. So it's a pretty controlled environment.
And the rooms are cleaned after every patient?
Yes, they are. Everything is scrubbed down. And since we have so many rooms, we don't use that. We scrub that room down, then we'll use the next room. Scrub that room down after the patient use the next room. So everything is cleaned very, very well. Patients come in one door, they leave another door.
That's amazing.
Susan, you're in quite an area in Brockton. They have a high amount of COVID cases. Are people starting to come back and take care of their regular health?
Well, they're trying to make appointments for physicals, but we're unfortunately those are the types of visits that are not part of phase 1. So
that's
we're
on
scheduling
hold
them. They are. So we're hopefully in the next few weeks. So we're scheduling those for in the next month, about a month from now.
Good.
So the good thing about Brockton is the high school is now offering, of course, a free drive-up, no order needed COVID testing. But they do have to make an appointment, though, just so they don't have a ton of people at one time.
Right. That's good. They opened that.
Prior to this, we would give them an order to go to the hospital to have it checked. Yeah. So
what type of testing are they doing, Susan?
They're doing the nasal. Some are doing oral, but most are doing the nasal swab. Yeah, so very similar to the flu. You have to get that swab way back in the nasal cavity. So it's uncomfortable, but it's the best we can do.
What about the antibody test?
Are the tests coming back faster than they were before? I know originally it took 7 days to get an answer.
Yeah, now it's 2 to 5 days. Yeah.
2 to 5, yeah.
Yep. Sometimes the Department of Public Health in the town is notified before we are.
Yeah.
But so as long as the patient knows right away, so the minute they call with symptoms, we self-quarantine them at that time. And then they go get tested, and they have to self-quarantine until they get the results back.
Mm-hmm.
So
how are you doing with the teleconference as a nurse? You feel it's doing a good job?
I think so. I love it. We really like it in our office because it allows us to reach patients that probably wouldn't have come in, or we wouldn't have had access to. And because we do have a lot of older family practice, so we see newborns up until very, very old patients, they probably wouldn't have come in, especially our babies and moms and dads with children.
Right.
So we're making sure we're calling out to people, making sure everyone's okay, and they schedule their follow-ups when we can see them, and especially our seniors, making sure, because a lot of our home care services it's now skeletal type visits. Patients aren't getting their care maybe once a week as opposed to 4 times a week. So the home care is a huge issue for a lot of our seniors. Mm-hmm. Daycare issues, all these things have disrupted family lives. So we're reaching out. We have a couple of people in the office that call and make sure everyone's doing okay. Parents are calling and wondering when they can schedule their children for visits. Any vaccinations we can do right now, they can come in, keep those updated. Those babies are important to get vaccinations and get their checks. New babies come in, but again, it's a controlled environment so that no one is ever exposed. Yep, we still see lots of new babies at this time, a lot of babies being born.
That's excellent.
Yeah. But this new telemedicine is going to be wonderful. If it's allowed and we can continue doing this past this COVID epidemic, I think it will be wonderful for healthcare and primary care. So it's just
Liz, do you have any questions? Sorry, Susan.
I was wondering about the billing. A lot of people say you're billed the same as an office visit.
As far as I know, you do.
Does it go through insurance the same way an office visit would? I'm wondering if they have co-pays or how all that works.
You will have a copay if you have a copay.
Yeah, I'm just wondering about a lot of people that don't have insurance. Are they avoiding it? How does all that work?
Well, so far, most people have not everyone has insurance, of course, but our patients all have insurance, and if they happen to have lost their insurance, they can talk to our office manager about arrangement. But it does go through the insurance, and we do the same things we would do on a visit. So we go through the chart, making sure your problem list is up, your medical history is up, your medications. We do all that stuff that we would be doing in an office visit too, while you're on the phone. Right. So it takes time, but instead of coming in, you'd be paying you're paying copay to come in. Now you don't even have to get in the car and drive to us. You're actually at home, and we can do exactly the same things, except for patients that need to have us touch them, look at them, check their blood pressure, EKG. Those are different. Those are totally different visits. So, but for the most part, there are a sector of our patients that do not need to come in all the time.
That's pretty interesting.
Yeah, I really like it.
Really.
So, like example, I saw a patient this week for an urgent visit, and I did an examination on her, after asking her tons of questions. We did some labs on her, and I said next week schedule a doxy.me, which is our video visit, and we will do a video visit, and I will go over your labs. I gave her some homework assignments, lots of education, so we'll see what she's done in the meantime. So the two of us will come together on this video visit for a visit instead of her coming in, getting someone to watch the children, driving here. She can stay home and do this visit.
It's actually more convenient for the patients, really.
It is.
Yeah.
For most, not all, and not every visit. We can't do a physical over the video visit. So,
do the patients say they like it?
Yes, they do. They really do.
Yeah.
Some would get a little frustrated with this whole app thing, more of my patients that aren't computer or phone savvy. So I've had a couple of failed video visits. When I say failed, they can't connect. I just disconnect and I call them. And I said, there's going to be a phone visit instead.
Yeah. That's excellent. Yeah, that's very good. It seems to be going well. Everybody seems to like it. Yes. Yeah. Yeah.
It's new, and I think that I saw a patient the other day for a first new to our practice. So during this visit, I just went through his entire chart, just asked him all the questions that I would ask when he was in here. He was just establishing his care and needed some medication refills that he was getting from his previous provider. So it worked out very well. He really didn't have to come in. He was healthy, no blood pressure. We didn't have to do vital signs. We would have done them if he was in the office, of course. And it worked out quite well. And he was about 45 minutes away. So this would have been,
it's nice to hear up close and personal with how it's actually going. We hear so much about it on TV and all, and it's nice to know it's all going well.
It is. So when you make the visit, our front desk tells you about the app that you download free. You put that on your phone. And at the time, like usually 5 or 10 minutes before the visit, you will log on, and you'll wait. We call on our side of the video in the office, we have a waiting room, and in that waiting room, in that video chat, you'll be there. So I will click you on, and as long as you give the app the ability to video and audio you, we can have this conversation, seeing each other. So it works out quite well. They're tickled pink when they can actually see me and I can see them, and we can talk about things. And I'll usually show them things because I can show them things from the office of what I would like, and we talk about things. They'll actually show me their rash and feel wherever I want them to feel if they have a pain, and I'm assessing whether they need to be seen or not. So it works out quite well.
Excellent. Very good.
Liz, I think you were going to ask a question.
I was going to ask a question, but really Susan answered it about the labs. So, but I did want to make a couple of comments because I use telemedicine myself through my provider, and I just started doing it about 2 weeks ago, and it's with my mental health provider. And I have done both ways, on the phone and also through the patient gateway. It's like a Zoom type thing where I can see the provider, and she can see me as well. And if we get disconnected, she calls me back on the phone. And I think it's great because I don't want to leave my house, okay, right now. My sister is very high risk. But I was also thinking about when my mom was alive, you know, at the end of her life, it was so hard for me to get her into the car. I had to use a wheelchair, and it was difficult for her to walk. And it took so much out of her health-wise just to get to the doctor. If we had had this would have been so wonderful, you know?
I agree, Liz. I agree. And that's exactly what we do. So we do the video Zoom, and if you get disconnected or I get disconnected, I call you and do actually a phone call visit. And the Zoom is the exact same thing that we don't use Zoom. We use a different type of format, but that's that same thing where we get to see each other, which is really nice. And a lot of my seniors will have their children access it for them, and sometimes I have like a little group visit. I've got the patient and maybe the son and his wife. But yes, it gives me a whole perspective of what's going on. And you can do a lot of stuff, assess safety. There's so many things you can do when you're watching someone and they're talking to you. It's really nice.
Totally. Your assessment skills are still there to, listen, see, and you just can't feel. But, a virtual visualization can tell you a lot.
Right.
Yes. And I agree with the mental health. This is going to open up more doors and more access to mental health, I hope, because we have so many patients that either can't get to places. Hopefully there'll be more providers too, but I think this is going to be wonderful for patients like yourself, people that can't leave their home and even don't want to leave their home. We just probably need more providers. Right now, after this, even now and after this epidemic, we're going to need more providers. There's a lot of sadness, depression, anxiety, fearfulness right now.
Absolutely.
Well, what are you thinking about? Do you think we can get this for the future? I mean, once this pandemic is over, what are the chances of that being on the list to do?
Healthcare is really liking it. We're in the primary care setting, and I'm sure in other settings, we really like it. So we're hoping it stays. It's been quite helpful for our patients. I hope the patients will speak up and really help say that this is a wonderful avenue for access to health care.
That's awesome. And now, before we close this talk, anybody have any other questions?
Well, I just have go ahead, Lori.
No, I think Susan did a great job answering all the questions. It's kind of a very positive thing that's coming out of it, and I bet we'll end up using it in the future. That's what I would think.
I'm hoping.
Yeah.
Liz?
Well, I was just going to say I have an idea for an invention. If the insurance companies supplied say an iPad or a laptop, a small one, and they had a little device that would hook in that had access to a blood pressure cuff, an oximeter, and a temperature thing, you could do that physical part of that, examination. I think that's something that should come out in the future. I'm sure it will eventually. I just thought I'd put that out there. It would be if I was a provider, I think that would be very cool if I could see even like their heart rate or whatever. I do know that some of the doctors had cell phones that were able to auscultate and also hook up to an EKG. That was when I was working. They had special phones that did that kind of stuff. So I think that maybe this is the wave of the future.
Liz, I'm laughing because we were just talking about that. Dr. DeFalco, I work with also, and we were just we noticed something on the internet. It's $500, and it's this item that does exactly what you said. All your vital signs, your EKGs, your pulse ox. I'm not sure if it had a Spiro in it, but it had quite a bit of things. And we were thinking, gee, too bad all of our patients, or most patients could have one of these. We said the same thing, especially like certain patients, not everyone, but certain more of our critically ill patients could have one of these items at home. This would just help our visits. We said the same thing yesterday. I can't believe you even mentioned that, but something that would allow us more information, especially for our seniors. I saw a senior yesterday in the office, and he was 92 years old, and he came in for an acute visit. But, he had to get a ride, and this just, everyone that comes in the office, whoever brought them there has to stay out in the car. They're only one person. So he was there by himself, and his daughter was out in the car, so I had to, call her and just kind of get some more information. But, he a type of visit that I wish he didn't have to come in, but he did. He did have to come in.
Mm-hmm.
So he's someone that's too bad.
Well, you'll have to update us on what happens in the future.
Okay. We think all these wonderful, crazy things, but that was something we were just talking about yesterday.
That's cool.
Yeah, thank you.
Susan, this has been really, really good. Anybody else have any questions before we end?
I think it's nice to hear that it's going so well. We hear so much about it, and it's a whole different way of looking at medicine. And it's just nice to hear that it's going as well as it is. And thank you, Susan, for your work working with all these patients. I know it's not easy, especially at first, and appreciate the fact that you're taking care of these folks.
Thank you very much. Thank you.
Well, then I'll say thank you to you, Susan. You're doing a fabulous job. Nurses are really out there doing everything. And Laurie and Liz, thank you. And thank you to the listeners. It's been a very informative learning about the telemedicine. I think in the beginning everybody was a little concerned. And, how are you going to really check me looking through a video? So to all the listeners, you can hear this on Stop Healthcare Violence. You can hear it on YouTube, Stryker, iHeartRadio, Spotify, and Apple Podcast, and there's a few others. So thank you all for listening. Thank you.
Thank you.
Thank you.
Jeannie?
Okay. Yes, thank you very much. This is Jeannie White ending the conversation, and it was a very informative, and I'm sure the listeners will enjoy it. Thank you again, everyone, for joining into this informative interview. This is Jeannie White, producer of the Wine and Cheese from Passionate World Talk Radio. Everyone be safe out there and have a good Memorial Day. Bye now.